Hello, I'm Dr Elsa van Duuren. I'm a rheumatologist and welcome to this video series about gout, which is a really important condition. In this series we're going to look at various aspects of it, from how would you know that you've got this, what is it, what causes it, and obviously very importantly, how do you treat it. So to start this off, we're going to look at what is gout. It's really something that mankind has known for a very long time, but what we're seeing is that there's an increase in the number of people that are affected by this condition, and it really causes a lot of problems with the people that suffer from it. But it can be treated very successfully. Unfortunately, it's often still poorly treated, and because of this, we think it's important that people know what's going on with their treatment and their disease, so that they can also be part of the management to know how to treat it effectively. I think what's very important about it is that it's a reversible disease. You can treat it effectively, and by doing this you will get the crystals that cause it to dissolve, and the disease itself will improve and it will be completely gone on treatment. Now, I think what's also important about gout is that it's often seen as a problem just caused by things that you do to yourself, but it's in fact is a disease as such. It can be worsened by lifestyle factors, it can be triggered by lifestyle factors, but it's not actually caused by what you do to yourself. So what is the cause of gout? And many years ago they thought that it was a little devil that came and bit you and caused the pain that you feel when you have this terrible, what they call an attack of gout. But we actually know that it's caused by crystals that form all over. They actually form in all sorts of tissues, but they form in your joints, and what you become aware of is the body's reaction to these crystals. And this manifests as what we call this acute gout attack. So these crystals are, the full name is monosodium urate crystals, or MSU crystals, and the pain that you feel is the body reacting to these gout crystals or these urate crystals. Now, I think another thing that's important about this is that we often have people talking about, is this uric acid? Now, urate and uric acid are really the same thing, but in the body, urate is what we really see, and uric acid gets passed out. And I think people often think that there's some acid in their body that's causing this disease, but it's not really. It's this thing called urate. So where does it come from? Now, urate is made when your body changes things called purines into urate, and purines are things that are found in all cells, and as you know, cells are the building blocks of any type of tissue, whether it's your body's tissues and obviously the food that you eat. Most of the urate that you make actually comes from your own body and not from the food. About 2/3 of your urate comes from your body's own formation of urate. What then happens to it is it goes into the kidneys and it's passed out through the kidneys, but some is also passed out through the gut. So once urate has been formed in the body, it also works as an antioxidant. So it helps for things that are in your body that can cause problems. But most of the issues that we have with urate is that it causes inflammation in the body. And it's not just in the joints, but also the body as such. And we're going to talk in a later episode about the other effects of urate, and those are the so-called comorbidities. Now, the problem with urate is that you have too much from either the cells that are being broken down or too little that's being excreted, and this then it causes an imbalance. You have too much urate, and the so-called hyperuricemia, or what's the big term for too much urate, is what causes gout. But there are people that have this raised urate or hyperuricemia that have no problems. But the ones that do have gout are the ones that we're going to be talking about further. And in our next episode, we're going to talk about how do you know if you have gout.